And welcome to today's educational webinar. We're really thrilled to have you here. Today we're going to be speaking about AI in action, tackling clinical denials, and maximizing out-of-network payments under the No Surprises Act. I'm Erin Haney, and I'm the Vice President of Marketing here at Aspirion, and I'll be moderating today's session. Before we get started, I want to share two housekeeping items. First, we will be recording, or this session is actually being recorded right now, and we will share that recording with all of you following the session. And then second, we will be carving out some time at the end of the session for questions and answers. So if any questions come to mind as we go through the presentation, please go ahead and use the Q&A feature within the platform and submit those questions. Again, we'll hold those to the end and get through all of them that we can, time permitting. All right. As far as, before I introduce our presenters, I want to take a minute to just introduce Aspirion for those of you who are not familiar with us. Our mission at Aspirion is to get providers paid accurately, quickly, and transparently for their work through the fusing of human expertise, artificial intelligence. And by doing so, we hope to make healthcare a more affordable and accessible for all. We are a tech-enabled service, and you can see here on the screen from our wheel, we segment our services based on two kind of areas, revenue integrity as well as complex claims. So that's a little introduction about Aspirion. Now let's move to introducing our speakers today. I'll go ahead and pass that over to Chase and Nikki for some self-introductions, and then you can go ahead and get going into the presentation. Thank you.
Yeah, thank you, Erin. My name is Chase McGrath. I oversee product development at Aspirion and focus on our AI portfolio of solutions, and so partner very closely with our operations leaders, our technology partners, and our clients to really figure out how do we take the best of the best in the tech world and bring that to bear with our tech-enabled service, offerings that Erin just went over, and create better results for our clients. And I'll hand things off to Nikki.
Lovely. Thanks, Chase. Hi, everyone. My name is Nikki Richson. I'm the Director of Operations at Aspirion. I specifically oversee our out-of-network recovery and NSA operations. So very excited to talk to everyone today. So for today's session, we have 4 key areas of a roadmap we're going to cover. So first is the landscape. So the scale and the challenges, just from a high level, of clinical denials and out-of-network under NSA. Then we'll go into AI as the connecting point, so AI and automation and how there are shared efficiencies between denials and out-of-network. Third, we'll talk about developing your AI strategy, so navigating your build, buy, or your partnering, and also what matters in those spaces. And then, as Erin had mentioned, we have time at the end for some Q&A. So starting first, again, very high level for clinical denials and out-of-network NSA and looking at some of those numbers. So in the clinical denial space, we know that the impact is well over 200 billion in annual claim denials for hospital organizations. Denial rates are continuing to climb year over year. Currently, around 15 to 17% of all claims submitted have denials associated to them, which of course means that the average time to resolve those not only becomes more complex, but the time and the hours to complete grows year over year as well. In the out-of-network NSA space, the impact is heavily circulated around reimbursements, with reimbursement to a percent of billed charges being, typically less than 15%. This is far below Medicare and Medicaid levels in a lot of cases, and then, of course, much lower than any organizations would see under a payer contract. So with these two service lines and scopes, they do share a dual burden, not only financially, but also administratively. With denials, just from 2016, which we know has only grown ever since, each hospital is averaging about 5 million in initial denials, which has its administrative costs. The more denials you receive, the more staffing, the more time associated with trying to get these resolved. And then the frequency as well. So in 2024, the denial frequency was closer to 12% and year over year. In out of network, as far as the financial burden goes, we know that there were over 3 million disputes that were filed between 2022 and 2025. More providers are becoming aware of the dispute process and more educated on this in this space. So we do see nationwide where disputes and those filings are continuing to grow. The reimbursement outcomes do continue to be very successful for providers. So we do know that when providers push back, providers are winning 88% of their cases, and typically those winnings are 3 to 4 times over network rates and that initial QPA. Now, although that 88% sounds wonderful, it does come with its administrative burdens, with 1.4 million IDR disputes filed in 2024. And those disputes, although again, very high percentage of winnings, come with timelines and delays in getting reimbursement for your organizations. Lovely. So since the No Surprises Act is a little bit newer in the healthcare finance space, we just wanted to quickly touch on some of the highlights regarding the No Surprises Act, and then this way you can also see how AI will tie in to assist in this space for your organizations. Perfect. So first, looking at the federal IDR process timelines. So first off, there are key junctures that have to be hit throughout the entire process for your claims resolution. First, looking at some quick timelines, some overviews. So you have 30 business days to submit open negotiations, 4 days to file the IDR, 10 days to submit offers, and then 30 business days leading to decision. And if any one of those points is not hit, maybe you accidentally miss filing the IDR by 1 day, unfortunately, your claim has stopped. So especially if we're talking from the IDR perspective, you're already probably 100, 120 days in at that point of pursuing the claim, and missing that IDR deadline can mean 100 days of lost administrative time to resolve these claims. So it's very important. The key takeaway in anything NSA related is to make sure that these timelines are trackable, that they're followed from all levels, that all levels have insights on them, and we move through the process. Now, overall, historically for the process, from the day that you file your claim as a provider to the day that a payment is issued, you're averaging closer to about 200 days. So the entire IDR process, not only is it, about hitting those key points, but it also is marathon and not a sprint. Perfect. Very quickly looking at the state versus federal IDR process. So currently there are 22 states that use their own IDR process. Those are hybrid states. Typically, the federal IDR process applies to self-insured plans in all states, and then fully insured plans, the federal process does apply in most of them, but typically the states have their own rules and regulations. Specifically, states like California, Georgia, New York, and Texas, they also have state-specific laws that take precedent for fully insured plans. Perfect. With the IDR negotiations and submissions, again, we know that it's a bit of a lengthy process. As we showed, we're getting closer to 200 days, but when providers are submitting those IDRs, especially given what is documented from 23 through 24, providers are initiating 99% of those disputes, and they're winning more than 80% of them, which is wonderful. So we know that the time can be worth the payoff, but the burden can be, again, managing those timelines and managing the process as a whole to ensure the success at the end. Some other key considerations for the IDR are some of the key factors that the IDR entities look for. So when you are submitting your negotiations, when you're working with AI to build your processes, you do want to look at what the end result is going to be and what that documentation, what those key factors will be. So some key things to look for are the level of training and experience from the facilities and also the providers, looking at the market share that's held by the non-participating provider or facility, the acuity of the individual receiving care, the teaching status, case mixes, and overall scope of services for the facilities. And then also what I think is a nice key takeaway is the demonstrations of good faith efforts. Now, that's not often just working through the open negotiation process on that singular claim. This does include expanding that scope to the organizations, the hospital organizations, working to negotiate contracts with certain payers. Unfortunately, between the two entities, they're unable to come to an agreement and the services for that plan fall out of network. Those discussions and good faith efforts between both parties can also help drive IDR winnings, especially if the provider organizations are asking for what they were, asking for in their contract. So they're not reaching for large sums. They're not asking for anything that wasn't already due and already negotiated in good faith. So there's a lot of really great documentation that isn't just the medical record that can help drive your IDR winnings and successes. Perfect. And I will pass it over to Chase to talk about AI in these spaces.
All right. Thanks, Nikki. So we're going to kind of shift gears here and really talk about the convergence of these two areas of what we see doing this type of work every day. And I think we'll also connect a lot of dots for hopefully folks on the phone around what you're seeing, what you're experiencing, and how technology can really maybe knock out two birds with one stone. All right, so I think it's always important to level set on what actually is AI. It's become a very ubiquitous term. We are inundated by content and conference presentations and things on LinkedIn about AI, but like, what actually is it? I think it's really important to define that up front because it might surprise you what actually goes into different levels of AI. It's basically a broad term for a lot of different software application systems that are essentially doing one thing just in different ways. They're trying to simulate human intelligence and like the reasoning that humans do, and particularly using computer systems and machines to try to execute that. And as we break that definition into kind of different levels or different components, there's really three levels of ascending complexity of AI. So level one is going to be things you might already be familiar with or use every day. So rules-based systems, very common, sort of the most rudimentary iteration of this, but it technically is AI. Robotic processing automation, also known as RPA, that's actually another form of AI. But again, these are the sort of simplest forms that can be implemented. And then level two, so natural language understanding or computer vision, those are the types of things that are a little bit more advanced. They're taking in more advanced information and doing something with it. And the most common example of that, right, is the assistant on your phone. So asking a question, find restaurants near me, and then getting some recommendations back based on the intent of your question and the data that's available. And then the most advanced level that we have now is in the generative AI space. So that's really going to include the ChatGPTs of the world, what we call large language models, and that's basically taking a very complex set of inputs. You can imagine an entire document or medical record, really complex prompts or series of prompts, and then producing very complex outputs and doing a lot of reasoning all along the way. So now LLMs can generate computer code, they can build applications or websites. And they can even write appeals, which we'll talk about a little bit later. And how does all this work? So at the core, all of these systems are basically following 3 steps, or really 2 steps, and then there's one differentiator that I'll talk about. So data ingestion. Everything AI does, like it's really taking data in, it's understanding it, it's analyzing it, and then doing something based off the prompt or the intent or the rule that was written. It then is going to do some reasoning. So following a rule, that's also reasoning, or completing some really complex inference, that's also a form of reasoning. But the kind of principle is the same. So taking data in, doing some reasoning over it, and then basically producing a desired output, whether again that's an appeal letter, recommendations for a restaurant, or any number of things that we can do with technology. And the key difference between these systems as we think across those levels is how does the improvement or learning piece come into play? And some systems can learn, with a lot of the machine learning models that we have with LLMs. There is the ability to have feedback built in, and that learning mechanism either automatically happening or happening on a periodic basis. Other systems, as we know, like a rules-based system like RPA, very brittle, very fragile, and there's no learning built in. And the reason why we're talking about all these things now is because things have fundamentally shifted in the landscape, in the market, in the last 5 years. And so we see now that cloud computing in healthcare 10 years ago was a little bit of a dirty word. Now it's basically table stakes for a lot of applications and systems and stacks that hospitals are using. And it's giving essentially on-demand, unlimited capability to run data analysis, to run applications, to host large language models. So really, again, that's kind of unlimited capacity to do a lot of powerful things with the tools we have available. And mentioning tools, the tools that we have are much more advanced than they were a few years ago. Even when I started in this space, generative AI was really just an idea, and now it's something that anyone can access through basically their phone for free. And then at the enterprise level, there are a lot of pretty amazing applications and tools and softwares available that again didn't exist a couple of years ago and are extremely powerful. And we talked about data, right? We want to ingest data to do some action, to do some reasoning. The data that we have available is also much more, broad and vast. There's a lot of challenges bringing that data together. But the good thing is, instead of having sparsity of data or a lack of data, we have more than ever. And that gives us a lot of advantages as well. So, as Nikki was alluding to, as we thought about addressing clinical denials and the out-of-network space, and addressing, negotiation letters and trying to execute that process under the timelines that we have, there were a lot of shared problems, and then in solving those problems, shared efficiencies. So we'll talk through kind of the core of those, but really, when we think about the out-of-network space, as Nikki mentioned, there's sort of those 5 areas of the scorecard. And there's very tight timelines that we need to make sure that we hit all along the process to ensure that we're not hit by administrative hurdles or stumbling blocks. On the denial side, it's a similar story. It's just the timelines are slightly different. They're more payer specific, and the kind of root cause of what you're addressing with the appeal might be different as well. But again, the framework is the same. We're trying to establish the acuity of the care provided, lay out the kind of background of the case around attempts to get authorization or good faith efforts to negotiate, and then really making the ask clear on the other party around what we are asking for, a certain percent of charges to be reimbursed, against that QPA, or again trying to get the full contracted rate reimbursed against between a specific payer and provider. And the output, right, the deliverable is similar, and so the technology needed to complete that and then also kind of run the process end to end, also very similar. So again, concepts are the same, but then it's the actual deadlines themselves, the actual entities are different, but that overlap is pretty clear. So as we thought about building a system that can really do both and handle both very well, it was a pretty easy and I think a little bit surprising at first insight that if we build it one way, it's actually very easy to then configure it for the other side of our kind of service line house. Yeah. And so, as I mentioned, we have AI platforms now that can integrate very seamlessly with the EHR systems and the payer portals that we need to use to really pull the information of interest from one side and then send it where it needs to go, and then track the workflow at every step of that process. And so now, as we thought about integrating technology into our account and NSA lifecycle, we're able to go kind of left to right and use tech at every step of the way. And again, as I mentioned, tracking those dates, those tasks, those phases of that life cycle very discreetly, and ensuring that we're not missing deadlines or missing deliverables, and losing out on small kind of technicalities as part of that process. And on the front end, we're able to ingest that NSA RARC directly on those placement files that you would get from an EHR system to know what kind of issue are we seeing here, and then being able to route things intelligently to the right work queues and resources. We're also able to alert and track the days remaining on those open negotiation periods, the cooling off period, as well as that IDR eligibility window. So again, not wanting to miss deadlines, keeping on top of things in terms of days, because we don't have maybe 6 or 12 months to appeal something. We have a very limited window here to really address that case meaningfully and get a better outcome for the client. And then we're able to then track and triage those responses from entities. So as we get a response back via mail, we're able to ingest that very easily, understand the intent of the response, again, route that to the right person and resource on the operational side to respond to that meaningfully. And then just centralize all of the single case agreement, IDR, and MR information in one kind of secure, centralized place, so that we have really a consolidated source of truth. And that is for us, and then as well as our clients who obviously want to understand how are their cases being handled, what do we know, what are we working on, what's the status, and ultimately what is the outcome. Great. And so, as I mentioned a little bit before, we're actually able to generate full negotiation letters using AI. So we'll kind of talk through on the next slide how this works under the hood. But essentially, with the capabilities that are available now with large language models, you can use them with a little bit of information on the front end, like a medical record, like basic claim details, like your admission date, your type of presentation. So was it someone that came into the ER and then was admitted? Was it a straight admission? And basically produce a submission-ready letter that can be reviewed by an operational resource prior to submission, but really accelerating that time frame. And as I mentioned, hitting on the major points of that case framework that Nikki laid out. So emphasizing acuity, providing key information about the facility, the context of the kind of care and services that were provided, and then the kind of timeline of the presentation, the progression, and then listing out some of the most expensive and kind of material services or treatments rendered. So that's something that would take a person at least an hour, if not more, to really do a good job. And this allows us to produce essentially a submission-ready negotiation letter within a matter of a few minutes, and then allow someone to do kind of that last mile review. And again, as we talked about, the timelines are very short. We're really always running against the clock to get things out the door, and meet those timelines. And so this just ensures that every case that we take hold of, we feel more comfortable about hitting those timelines, doing right by our clients, and making sure that we're following that process to the letter. But then also the work product and deliverable that's being produced to create the outcome, right? We want to have a good negotiation letter to get that reimbursement in hand and serve the end client. We feel very good about that, and know that the technology is actually helping us to elevate our craft with respect to those deliverables. Yeah. So what actually is going on under the hood? Just a little bit of behind the scenes of how you would maybe build an AI system to do this sort of task and produce an output like this. I've got a medical record. That's really my biggest data input. And as we talked about, what are AI systems doing? They're just taking data, doing some reasoning, and then producing your desired output. So the system that we built is basically, it knows it wants to create a negotiation letter. We've actually created some prompting and some configuration to take that framework of that NSA negotiation letter and then look for the information, highlight the details that are going to be most relevant to basically create the best version of what that letter could be based on the facts of the case. And so all of that can be broken into what I would call a question and answer set. The questions are, again, based on that framework. They're based on things that our own, letter writers would be asking themselves as they try to go through and satisfy the items in that list and really, again, create the best letter possible. And then the large language model, the kind of system underpinning this, is going to be going out and getting answers to those questions. And so on the left here, you can kind of see what that looks like just as one singular example. But you can imagine writing an entire letter requires many of these, and they're all dynamic too. So as I talked about, the type of diagnosis that we find, the admitting dates, maybe the age of the patient, they're all factors that could impact the acuity. And so the question set needs to be dynamic to those factors. There are things that are always going to be consistent around the facility itself or other parts of kind of the administrative process. But overall, right, this should be dynamic to really pull out the most salient details just based on the facts of the case. And so the large language model will kind of iterate through all those, answer them. The ones that it can't, it just knows to move on and be upfront about, I couldn't find anything. I'm not trying to hallucinate information, as we know is a problem with large language models. And then ultimately pulling that all into a letter to produce that output. Yep. And as we mentioned, there's a lot of overlap with these two workflows, and a lot of the technology and process can be shared. So as we look left to right, we're leveraging similar inputs. We've got those placement files. Those give us all that claim information that we need, as well as information about the payer that we're going to be working with, and then also pulling over documentation that we need. So that always is going to include medical records for these types of cases. And then we've got a denial or an audit letter that we need to be leveraging to just get more context about the actual payer kind of root issue with a denial specifically. We'll pull it over as well. And then as you look across these two areas, the workflow platform is going to be the same. The technology that's generating the appeal or the negotiation letter is going to be the same. And we're also leveraging similar types of resources. So clinicians, attorneys, appeals or NSA letter specialists. So people that really have expertise in the process and who work these types of accounts exclusively. And then as we go through the kind of submission and follow-up and status and resolution process, again, similar steps, similar mechanics. It's just the timelines are different and some of the nuances with the payer are going to be a little bit different. But these are the things that are, we know we deal with the same payers all the time. We know how they want to receive submissions. We know what their typical timelines are for response. And so we're able to configure a lot of those variables into the system. But we know that there is a follow-up deadline. There is a timely filing deadline. And so those are the types of things that just get configured per payer or per entity, essentially. And then the last step is obviously recovering that revenue and kind of fully resolving that account to our client satisfaction. Yeah. So we talked about how you can implement AI in, resolution of NSA accounts and then clinical denials. But before you can even think about building tech or buying tech, it really comes down to having a good strategy. So we'll just talk through decisions, risk, results, and developing that strategy and informing, what makes sense for your organization, and then hopefully give you some things to take away. So there's 3 strategic options that you can pursue. Building, buying, or partnering to develop, purchase, or collaborate on AI capabilities. Build kind of gives you the most control. It's going to allow you to build your own custom models. Everything's done with your own resources. And again, you have like full agency and oversight of that entire process and the resources involved. Buying something, you're going out in the market, you're getting something off the shelf, you're getting a model that's pre-trained or a solution that's pre-built, and it gives you a lot of speed as well. And then partnering, it kind of gives you the best of both worlds. It's the shared arrangement. Typically, it can be working with a managed service outsourcing partner. You can also be co-building or co-creating a solution together. And maybe you're bringing the operational or rev cycle expertise. They're bringing the tech expertise. But again, you have those two minds working together. And that really is, again, why we call it a hybrid approach. And as you're thinking about a strategy, it's also really important to think about where can this go wrong? What are the stumbling blocks, and making sure that you account for those upfront as part of your strategy. And none of this is meant to deter you. I put all these on here because these are all things that we encountered, and so trying to learn from our own kind of shortcomings throughout the journey that we've been on, because it is a journey. It takes a couple of years to really get this going. But I think overall, and I won't drain all of these, but you probably encountered a lot of these in conversations you've had or in meetings you've been in, where AI was discussed or emerging technology was on the agenda, and they all can be true, right? We have limited technology resources. How can we be allocating these to new projects or new vendors? We don't think that our strategy aligns to investment in this kind of tech, or working with a new vendor or partner around it. We don't have the right security frameworks in place. We don't have a data governance program. This introduces more compliant and audit risks and burdens. So again, all of these are things that we've heard. They've been conversations we've navigated. And I think as you think about all the benefits and as you think about some of the drawbacks, make sure that any kind of pitch or presentation is really including these factors, because you're going to want to get ahead of those detractors, as part of that overall pitch within the organization. Yeah. So as you evaluate, these strategic options, what's right for me, what's right for the use case that we have, and how do I ensure I'm successful with this and my team and organization are successful? You're going to want to think about all those key risk areas. This risk framework is not new. I've definitely borrowed it, but I think the risk profile for AI solutions particularly is pretty different than things you might have been working with in the past or other technologies that you've deployed. The biggest thing is, just evaluating each of these and making sure that you've accounted for it again as part of that overall proposal and pitch. Financially, AI solutions can have a big impact on the bottom line, but they can also be a very big, line item in your budget, without a lot of benefit to show for it sometimes. And we'll talk later on about how we get to a kind of risk benefit cost framework and figuring out the net of all that, but really consider the financial risk of what you're doing. Legally, any of these solutions where they're using PHI or sensitive data, there's a lot of additional risk and kind of legal exposure that you could be introducing. So very important to understand, what obligations do you have upstream? How can you ensure that downstream partners are following what they're supposed to and covering yourselves with the right paper? Operationally, a lot of technologies can create a very big disruption to team, to process, to the tools that folks use. And so making sure that you're accounting for all that, and it's one thing to buy a technology and implement it. It's another thing to get value from it and really see change. And some of the kind of biggest blockers that we've seen too are operationally, having the right change management in place, having the right enablement frameworks, and then seeing those through to successful execution. Reputationally, we see this a lot with the partnership. So that kind of hybrid approach that I talked about, it's great to go out and partner with the best in the business and some of the top minds in technology and AI. But also understand that when you do that, you kind of expose yourself to more risk than maybe if you were working with just a vendor or a third party, in sort of that kind of capacity. And so just consider who you're doing business with, how they represent you, and really what your reputation is in the market, and how you want to protect that. And then lastly, the structural risk that we see a lot too is, one, a lot of vendors are not necessarily going to be here forever. There's a lot of new entrants in the space. There's a lot of acquisition and kind of M&A activity going on. So really think about whether or not that vendor is going to be around in a couple of years to support what you bought if you signed a long-term agreement. I would also think too about, as we've noticed in the healthcare space and the technology ecosystem that supports it, are there any monopolies? Are there any partners or vendors that are really the only game in town? And so I always like to think about what's my best option, but what's my alternative, and what are my kind of costs to switch to that alternative? You may not have one. And so that's a really important thing to consider is, hey, if you really need this data or this talent or this technology, and they're the only game in town, that is a structural risk, right? Because you want to make sure that you preserve that relationship. Or again, if you can't find an alternative, create one. Yeah, so we've talked about all the risks, the bad things, what can go wrong or kind of get in your way. let's think about the benefits. So the biggest one obviously is you're going to get a new capability or new resources that can help you to level up your organization, the tools they use, the technology that's available that you otherwise wouldn't have. It also can enable access to new data or technology, as I said, to really give you things that would not be possible to build or create internally, and then allow you to kind of implement every part of your strategy more fully. We do this a lot. There are some things that make sense to build and to own. There are a lot of things that, hey, they've already solved this problem. Let me just go out in the market and see what I can do to kind of connect our need with what they offer. And then, as we talk about in the speed item here, accelerate our delivery roadmap. So vendors and really going out to third parties can provide a very big speed coefficient. I think in this evolving world where literally every 6 weeks there's a new model, there's new technology, there's new capabilities, it's a little bit dizzying sometimes, but speed is the name of the game. So the more you can use technology and partners to accelerate your roadmap, to accelerate your strategy, to kind of try things more quickly, I think that's the most important thing. Not everything's going to work out, but the point is to know that sooner, and to kind of, again, evaluate that alternative, know what it's going to cost or take to switch, have that ready. But being able to know that faster is definitely an advantage. Vendors also provide cost advantages. So there's just a lot of things that it takes longer to do yourself internally, and or it can be more expensive. And obviously there's the cost factor, but then there's the cost of delay. As we talk about speed, time to execution is a cost in and of itself. And so, again, accelerating that timeline can provide cost advantages to mitigate that risk. And then there's also just kind of structural advantages of some partners doing things for you at a lower cost. And then revenue, right? We think of a lot of the solutions and technology that we build or implement as being able to save costs, to take costs out of the organization. But there's not always that revenue component that we think about. And we'll talk about that a bit more in the value framework. But really think about, what revenue can this bring in for me? What is this unlocking for me in the market? Because that'll be a very big driver of, I think, a more productive CFO conversation. Yeah, so bringing this all together in a business case and a value case for AI investment and strategy. You have to know what your investment is. What's the headcount? What software do we need? What tools or capabilities is this going to take to be successful? And so those are very easy costs to measure, I think. It's just a matter of, figuring out your capital for human capital, and then also figuring out the kind of, line items on a tech vendor invoice that you would need to purchase. But there's also this opportunity cost or productivity loss that I would think about as well. As I mentioned, the change management and enablement piece is very important. Anyone that's ever done like an Epic or EHR implementation and go live, that post implementation deployment and ramp period is pretty significant. It's a very big drain on the organization. It's necessary, right, to be successful long term, but it's not to be undercounted. And I would say the same thing applies to AI investment, where you're switching tools or ways of working, or underlying tech stacks for backend or kind of back office processes. It will have an impact on productivity in the short term. So just kind of think about that as well. On the value side, so as I mentioned, the most common kind of framework or measurement tool is going to be efficiency or reduced labor costs, that kind of coefficient. I would also think about what revenue streams you can enable with AI. We found actually that the biggest driver for us was not just being able to do things with the same people but more, but then actually we were able to change the economics of what it takes to actually work on an NSA claim or a clinical denial, and then start to work on items that previously we never would. So going down that balance threshold, because we were able to use technology to address some parts of the process that previously were entirely manual. And so that for us represented kind of additional revenue that we otherwise would never have kind of gone after in the market. So, top line growth, bottom line growth as well. Usually AI can help you drive acceleration in both, but I do think it's really important to make sure you consider both, and then have that be part of the overall value equation. And then, as I mentioned before, time is so important. any of these solutions, think about how long is it going to take for me to at least make my money back. We know what the investment profile is. We have a pretty good sense of the benefit and outcomes and value we can create, but is it going to be 6 months, a year, 2 years? We don't know. That will also be a very big driver of the success of your CFO conversation. Is that we think within 12 months, within some degree of confidence that we can actually make our money back and then start to really generate additional value from there. And if you don't know what that timeline is, I would suggest figuring that out before that meeting, because that's going to be the first question you get. Yeah, so we've talked about investment strategy, evaluating the vendor landscape to kind of figure out the right approach, and then what are the kind of pros and cons of each. And I think the last part is really about impact measurement. And everything that we do, we have to show impact, we have to show value and outcome. And I think within healthcare finance, it's very difficult to do that quickly, and in a kind of consistent and in a manner that we know that we've made a difference. There's a sustained trend. And so one of the things that we talked about as we tried to figure out, okay, we've built a solution, we've invested, we want to see that there's some kind of impact, at least within the first 3 to 6 months. How could we do that? And I think the kind of early indicators are where you want to focus. So obviously the number one metric is cash in the door, over return on inventory, but then also being able to see that up front. And so we started to measure that in terms of our success rates and our kind of days to get first submissions or that negotiation letter out the door, which Nikki will talk about the NSA impact right after this. But before we can see cash, we can actually start to see resolution rates go up, and just the time that we can get that first appeal out the door and the time to closure starting to kind of move downwards, and overall, that timeline and cycle is accelerating. And so that for us was a leading indicator that we knew once these accounts are fully resolved, once we kind of pursue that payer fully and get that cash back, because we know that even when they say they'll pay, it's still a process to kind of get that cash in the door against the expected reimbursement. We know those numbers will work out, and we can feel pretty confident telling that story to our C-suite, our board, and that again we're seeing these move in the right direction. So I would challenge you to just think about absent those final metrics that really definitively prove that what you're doing is working. Think about the early indicators. Think about the things that within a relatively short time frame you can take to those stakeholders and say, I'm seeing it, the dials and knobs are moving in the right direction, and here's how and why. And I think even a scorecard like this that you can see on the slide is a very simple story that you can use to kind of tell that and convey the message. And with that, I'm going to hand it over to Nikki to wrap things up.
Thanks, Chase. For out of network and the negotiations to IDR, where we're seeing the results for AI and where it can benefit all organizations from the great takeaways that Chase gave us. Starting first with the placement to negotiation. So with really great data that supports the NSA RARC codes, those can drive AI triggers to submit the negotiations and get the initiation going. So typically what we've seen is from a manual submissions, so from placement to when a negotiation, is formally emailed or sent out to a payer, the beginning of the process, right, when this started in 22, going into 23, it was closer to about 5 days from placement to negotiation. Now with AI tools, the placements that we receive come in, they're triggered based off of NSA RARCs, and these submissions are generated that same day. So we're able to reduce 5 days off of the overall process, which is huge. Every day counts in this space. It also moves up the timelines for IDR, and of course gets revenue in the door faster in the long run if we have to go through that IDR process. So overall, even if we're focusing just on the open negotiation pieces of it, adding AI into it, being able to remove the initial, placement kind of data that you're sifting through for submission, and being able to get that out the door. AI also assists with follow-up, right, in triggering if a response has been received or one hasn't, and being able to do some of that follow-up itself. That overall, from what we've seen, has reduced days from placement to closure from about 37 days down to 21. So faster outcomes regardless, which is great. Obviously the best situation is that those reduced days come with additional revenue, but even if it doesn't, even if the negotiations were unsuccessful for a variety of reasons, it's still a reduced days where we can more quickly address trends and other identifications. Do we need to make improvements in the process? Is there a break in the chain? So it just reduces that time to true action instead of kind of waiting, more than a month to have any kind of results or anything to talk about in that space. What we also know is not only, of course, AI is helping us, get things out the door faster, get things responded to, but with that assistance, it is still continuing to bring in, 2 times revenue over the initial QPA, 3 to 4 times in the IDR. The IDR, especially that 3 to 4 times, is huge because providers are putting up, fees. You're kind of fronting a little bit of that cost of revenue that you didn't get on a claim to push it through an independent resolution. So being able to get additional, funds to cover the cost of fees and the time that was spent, right? So closer to 170 to 200 days. Helps the organization in the long run. But as always, and I mentioned this earlier, the IDR process especially is a marathon, not a sprint. So some overall key takeaways. Of course, it can be a shared technology that covers multiple service lines and multiple scopes. So these are 2, but within your own organizations, there's different ways that you can take this same platform and technology and expand it and move into different areas. So overall, you have one investment in 2 or more revenue streams. 2 being proven results. So for us at Aspirion, we have reduced our open negotiation timelines. We've increased revenue for our clients. So the results utilizing AI in this space continue to speak for themselves. 3 being a strategic choice. So as Chase mentioned, whether you're building, you're buying, or you're partnering, there's really, the 4 C's that you have to take into consideration for all of those. So evaluating your capital, capacity, capability, and commitment. And 4 being act now. We know that the payers are actively utilizing and deploying AI at a large scale. Not only are we seeing this in the mass amounts of claim denials that are continuing to come in the door, but you're also seeing it typically in your responses and response letters and having to sometimes correct what the payer's AI is sending back to you, unfortunately. So it's kind of one of those, fight fire with fire situations. AI is helpful for the providers on that scale to review your claims faster. It can also help you on the organization side to get appeals out the door faster and to strengthen those appeals and lessen, an analyst needing to spend 45 minutes to an hour, writing an in-depth appeal for an inpatient stay, where AI can help take the lift off, and instead that person can utilize their expertise to kind of spot check and add in any areas. So the 2 can also work in tandem to speed things up, which is always beneficial. Thank you everyone so much.
Thank you. Sorry, it looks like there's a little bit of a lag as we're moving through slides and joining back on camera. Thank you, Nikki and Chase. Great information shared. We have time for maybe one question and maybe truly don't have time, but we're going to make time. And this question actually came from someone that works at a facility in California. And this one's for you, Nikki.
Okay.
She or he asked, how do you decide if a case goes through the state process or federal?
Okay, great. So the question is state versus federal process, specifically in California, which we know is a large market. They have the Department of Managed Healthcare, DMHC. So typically what we see in this space is that your state versus federal is going to depend on whether the health plan is state regulated, so it's fully insured, or it's federally regulated, meaning it's a self-insured plan. Now, it sounds more complicated than it is technically. What we have seen is that a lot of payers, maybe not a lot, but some of the major ones, are identifying this and putting a remark and a comment on the physical EOB itself to say, this claim qualified for NSA, and if you need to dispute this, you can follow through the DMHC, or they'll specifically say the federal regulations. So sometimes the EOB itself can be a really great quick identifier of which direction it needs to go. Also, we started to see an uptick in the last year, 6 months to a year, where the patient's insurance cards will actually have a little indicator. I've seen this most recently in Illinois, but the patient's insurance card will have a little DOI, DMHC, they have a little state indicator on there that can also be a trigger. So there's, I think, 2 key things that are a little bit more visible. The worst case scenario, if someone really is trying to, they're unsure of which way it can go, unfortunately, it does kind of turn into like a phone call or checking, a payer portal to see if it's a fully insured or a self-insured type plan.
Great. Thanks, Nikki. Hopefully that was a good answer. If not, you know how to reach us, that individual, and we can dive deeper into that question. Well, we're at time. Thank you so much for joining us today. We hope you found this session helpful and you have some action items that you can take back for your own self or your team. Hopefully you'll fill out the questionnaire that will pop up after we close out the session. We'd love to hear. We're looking for opportunities for making things better, these educational sessions. So hopefully you'll take the time to do that. Have a lovely day, and we'll hope to see you online again shortly. Thank you.
Thank you, everyone.
Thanks, everyone.